Guys, welcome to my YouTube channel Resident Not 7. I have created this YouTube channel especially for helping NEET PG and INA-CET aspirants as well as MBBS students who are struggling with core medicine topics. I am here to help you guys, so kindly subscribe my channel and hit the bell icon below. Thank you. Hello everyone, welcome to my page Resident. Today I am going to discuss about how to read a clinical case in less than 60 seconds for INA-CET and NEET PG exams. So we shall go to the topic. So clinical based questions are getting longer, trickier and more confusing. But what if I told you there is a simple way to read and solve them in under 60 seconds? Yeah, 60 seconds is what you need in order to solve these clinical based questions in your exam. Exactly, you will have 54 seconds, not 60 seconds to clear these questions. So many students waste their times unnecessarily reading full topic, full questions, and panic when they say long clinical scenarios. The result, they either run out of time or choose the wrong answer. So in this video, I will teach a 5-step method, 5 proven strategies that will help you read, analyze, and answer clinical questions quickly and accurately. Let's get started. So, step 1, always read the last line first. For example, in this question, the last line is telling patient is having pulmonary fibrosis, right? So, patient is having pulmonary fibrosis. So, which of the following drug causes it? So, the answer is straightforward. The answer is amiodarone. So, just by reading the last line, you can save plenty of time. And later you can go through the unnecessary details. But once you have seen pulmonary fibrosis, you will know clearly that it is due to amiodarone. So, step 2, always identify key clues. For example, for a patient who is presenting restlessness, tremors with previous history of bronchial asthma, he has a swollen neck in the neck. PP is elevated, tachycardia is. So, swollen neck with the tachycardia is always what? It is always thyrotoxicosis. But here you have to note, patient is having bronchial asthma. So, in bronchial asthma, non-selective beta blockers are contraindicated. So propranolol can't be given. But patient is having atrial fibrillation. What do you have to do? You have to control the rate. By which drug? We can use dilsem. So dilsem is the correct answer here, not propranolol. So you have to identify key clues. Here the key clue is bronchial asthma and atrial fibrillation. So I hope you understand this part. So step 3. So what is the step 1 I have told? Step 1, always read the last words of the question. Step 2, always identify key words in the question. And step 3, ignore extra details. MCQs are designed to waste your time with unnecessary information. So ignore it. What to ignore? Social history, extra lab values which are highly irrelevant and unrelated symptoms that don't match the final question. Right? So for example, here if you follow the step which I had told before, first you have to read the last part of the question. Here last part of the question is showing AFB test is positive. So with AFB test is positive, they are asking what is the most likely diagnosis. Most likely it will be tuberculosis, right? And already they are key clinical, if you follow the second step, the clinical history is fatigue, weight loss and night sweats, which is suggestive of again TB. So ignore unnecessary, still like is a smoker, consumes alcohol regularly. So just leave them alone, and you just focus on the key clinical points so that you can achieve the correct answer. So step number 4, check the answer options before going back. For example, before going to the case, just take a quick glance at the options, the 4 options. Okay, why this works? Because it helps predicts the right answer faster. If two similar options exist, it needs more careful reading. For example, in the question here patient for rate control they have given both propranolol and dilsem, but reading bronchial asthma only gives you an idea that beta blockers are contraindicated in bronchial asthma, non-selective beta blockers. So always see options and always group options together. So these kind of questions need very careful reading. So if opposite action option 6, it is easy to eliminate the wrong answer. But if two similar options exist, you have to focus on the options which are given and you have to group them together and you have to select the option which is best suited for the question. I hope you have understood this part. So again, this is the example as I showed. Here, patient is having atrial fibrillation, but the rate control drug here we have to use dilsem because patient is a bronchial asthmatic. So now let's putting everything together. Always read the first last line first and extract clinical cues. Ignore unnecessary things, and before everything else, check the options and group the options together. If dissimilar options exist, your chance of solving the questions increase. So that is very very important. So a patient present with sensory loss and weakness of limbs for 3 months. He has angular stomatitis. On examination, there is loss of proprioception, vibration sensations, UML type of lower limb weakness, and absent angle reflex. What is the probable diagnosis? So based on this history, with angular stomatitis, patient is having sensory ataxia and absent angle reflex. Probability is vitamin B12 deficiency. So the diagnosis here is straightforward. It is subacute combined degeneration of spinal cord. Okay. So again, a 40-year-old female came with complaints of chest pain, palpitation, and shortness of breath. So again, you have to, as I told, the first step is to look at the last words. So here, patient is having MDM. So MDM, where it will happen? Most likely, it will happen in mitral stenosis and tricuspid stenosis. But here, there is a prominent A wave on JVP. So prominent A wave on JVP happens in tricuspid stenosis. Okay, so here the two options which are similar are mitral stenosis and tricuspid stenosis. Don't jump and mark your answer as mitral stenosis whenever you see MDM. That's why you have to group the options. Here, mitral and tricuspid stenosis are two stenotic lesions, and both happen at the level of AV valve, and MDM will be seen in both of them. But the clear cut clue is prominent A wave on JVP, which is suggestive of tricuspid stenosis. So yeah. So I think with this method, that is first thing. Always remember, read the last line first. Second thing, always find clinical clues. And number third, you have to rule out unnecessary things in the question. And number four, always learn to group and ungroup options, and always choose the best option. By doing this method, you can easily crack your MCQs within 60 seconds. I hope this is useful. Follow this page